Welcome to the Find Your Influence podcast with Anton Guinea, where this episode is proudly sponsored by W. Daniel Cox III, who is a data governance advisor. When you can look at other humans and say, that's not how I want to end up, and change your behavior, then go and help other people not end up like that as well. Because I sometimes ask people about, influencing themselves, because you've got to be able to influence yourself to make a decision before you can influence other people. That answer was a real sort of demonstration of what it took for you to change your behavior.
That's a big thing that I talk to people about. Like they'll say, oh, your videos motivated me, or I saw this, and it's like, I watch your stuff for motivation. It's like, I don't want you to just be motivated. I want you to change your behavior.
Welcome to the Find Your Influence podcast with Anton Guinea, where we unpack all things influence and we help leaders particularly find their influence by talking to amazing humans and finding out what influence means to them, who they've been influenced by, and who they have influenced. And this podcast episode, proudly sponsored by the Guinea Group of companies. The Guinea Group helps leaders upgrade, upskill, uplift their teams and their influence. Welcome to the Find Your Influence podcast with the Anton Guinea team, where we talk to the most amazing humans just about what influence means, how to influence other humans in a really positive way, of course, and how to, have a positive impact on the planet while you're doing that and on others through leadership. Now, Dr. Jae, who we're talking to today, is the founder of Proof of Work Fitness. Dr. Jae is a pharmacist, a performance coach, and a health strategist. Now, what an amazing skill set and what an amazing human to talk to. So let's find out about Dr. Jae, and then we'll find out about what influence means to Dr. Jae. Dr. Jae Koonce is a practicing doctor of pharmacy with over a decade of experience across community, clinical, and hospital healthcare settings in the US. Alongside his clinical work, he's founder of Proof of Work Fitness, where he helps high-performing professionals align physical capability with long-term performance resilience, love that word, and lifestyle sustainability. Throughout his pharmacy career, Dr. Koonce observed a consistent pattern in chronic pain and metabolic decline. Patients frequently presented with obesity, poor movement quality, weak tissue, and long-term lifestyle neglect. The prevailing response was often medication-focused symptom management, or the underlying causes remained unaddressed. This experience led Dr. Jae Koonce to expand beyond traditional healthcare delivery and build a preventative, performance-driven model that addresses root cause rather than symptoms. What did I miss, Dr. Jae Koonce?
No, that's it. That sounds great. I appreciate the intro. That makes me sound really cool.
And smart.
Yeah, like sometimes we don't give ourselves enough credit because I'm really just focused on doing a good job and doing the stuff that I'm doing. Like sometimes it helps to kind of zoom out a little bit. I'm like, wow, we came a long way, came a long way.
And you must have, you talk there about sort of like a real traditional uni study, doctor of pharmacy, and then you talk about this shift from, I love the symptom to root cause stuff. How did all that come about, Dr. Jae? Maybe just give some of our listeners and viewers a bit of an idea of where that shift was, please, mate.
Yeah, so I grew up and I was actually going to be a business marketing major. That's what I was focused on originally. My stepdad, he owned a construction company. And so I was like, well, maybe I can, go to college and I can help him with that. Because working in construction, working in the ditch, you're outside, you're in the weather. And I'm like, man, I gotta go to college. Like, I don't want to be out here. At first I was like, let me be the guy on top of the ditch telling everybody else what to do. And then after I, worked a little bit more, I'm like, you know what? Just let me leave outside all alone. Like, screw working outside, let me go to college and so I can be in the air conditioner. And then after I started college, my mom died of overdose. And I was talking to my dad's accountant, and she kind of steered me towards pharmacy because I was looking for things like, how could I have, made an impact and, in going through what she was going through with the different medications. Of course, it's on her for, doing the overdose and mixing the drugs and the alcohol and the prescription medication that she was on. But I just felt like, how come there wasn't somebody throughout the process when she was going to all the doctors and all the pharmacies that kind of talked to her and asked her like what's going on, and nobody questioned how she was going to different doctors and different pharmacies. And so, it's like cliche as it sounds, I said, let me be the change that I want to see in the world. Let me be that type of pharmacist that's going out there and actually having conversations with people and saying, what's going on in your life that you feel like you need to do all these things. And so that's the kind of that I changed my major in college. So then that's why I got into pharmacy. But after I went to pharmacy school and I got out of class, well, like during pharmacy school, I ended up learning stuff about like binge drinking. And they say like 6 drinks in a row. If you drink more than like 6 or 7 drinks in a row, it's classified as binge drinking. And I was like, oh, well, sometimes I don't drink for a couple of weeks, but then I have a bunch of drinks in a row. And I was like, so that's what I do. So like, it kind of was like a mirror up to me. So it's like, it let me know that I was doing something that wasn't sustainable and that wasn't good, wasn't healthy. And anyway, you just kind of put it in the back of your mind. I'm like, oh, I exercise, I do this, I do that. So I get out of college, I start working, and then I see what's in people's grocery carts, because I worked at like grocery store pharmacies and super centers. So I would see what's in people's carts. I'd see them from month to month. I'd hear how their poor mindsets, it affected how they live their life and like their opinions on things, because everything's in your head, right? Like the big of a deal that you make about something, it's all in your head. And so I just kind of tied, just taking in the data and just kind of piecing all this stuff together. And then eventually I kind of looked at myself and said, I'm on a path that's unsustainable, right? Like, because a lot of these people, I started seeing them, they're in their 20s, their 30s, or late 20s, their 30s and their 40s, and they're starting to get high blood pressure, high cholesterol, diabetes, and anxiety and depression. And I'm like, I'm eating the same types of foods. I'm doing the binge drinking. Like, if I don't change something in my life, I'm gonna end up getting diagnosed with high blood pressure, high cholesterol. And so let me change myself. So that's when I started, like, I took the shift and started looking into like prevention and really digging into the lifestyle. What can I do on my own, my mindset and all that kind of stuff. So that's kind of what led me down this road. Like, it was a while before I started my business, but that's just what led me down like the rabbit hole of like self-improvement and wanting to improve myself. And eventually I turned that into helping other people after like 10 years of like working all the time and just trying to apply some of the stuff that I've learned. After I applied it to myself, then I started to say, okay, let me help other people. I know it was like a long-winded response, but that's kind of how I got here, basically.
Whoa, Dr. Jae, best response ever. When you can look at other humans and say, that's not how I want to end up, and change your behavior, then go and help other people not end up like that as well. Big deal. Big deal. Because I sometimes ask people about, influencing themselves, because you've got to be able to influence yourself to make a decision before you can influence other people. Mm-hmm. And I think for you, that answer was a real sort of demonstration of what it took for you to change your behavior. And I love it.
Yeah.
Thanks for sharing.
You're welcome. Like, that's a big thing that I talk to people about. Like, they'll say, oh, like, your videos motivated me, or I saw this, and it's like, I watch your stuff for motivation. It's like, I don't want you to just be motivated. I want you to change your behavior. That's what I really like, when people say, hey, I've dropped these, so many pounds, or my blood pressure has improved, my high cholesterol has improved. The doctor, they stopped my medication because I don't need it anymore, because I changed my lifestyle, because I'm doing things differently. Like, instead of going and getting this thing for lunch that I was kind of like in a habit of doing, knowing it was hurting me, now I shifted over and I started doing this, and this other thing. And I'm like, eating more whole foods, and my blood pressure improved, my cholesterol is way better, and I don't have diabetes anymore, or like I don't have pre-diabetes anymore. And so that whenever I kept getting stories like that from people that I would counsel and during the pharmacy, because sometimes somebody shows up and they're just like, they got like 9 different medications. They show up and they're like, I just went to the doctor and I got all these things, and they're acting like they don't want to take them. But, they realize that, like, if they don't change something, then this is, the road that they're going down. And so if they felt like, this is not something I want to do, then I would spend the time to explain it to them. Like, look, this is, it's called a DASH diet, dietary approaches to stop hypertension. And that's just like different ways of eating. There's exercising in there. And so I would give them like a crash course, like 10 minutes, give them links, and kind of give them a quick overview of everything to go, and give them some stuff to self-study. I'd like write website links and stuff like that down. over time, I had a couple of people, like a handful of people, come back and say, "Hey, I made improvements in my high blood pressure, my cholesterol. My doctor took me off of this medication, and I just want to say thank you because I don't see you in here anymore. I just wanted to say thank you." And I'm like, you know what? Like after COVID happened, and I'm driving to the pharmacy every day, I'm like, I got to do something. Like I want to help people before they get to the point where they're just ratcheting up on cholesterol and blood pressure and diabetes medications. Like I want to help people that are willing to put in the work, you know, before it gets to that point. And so that's why I started my business, so I could help people. And of course, if you're a Bitcoiner, if you know Bitcoin, I think about how can I give value to the network. And so that was a way that I could bring value to the network, even with my clinical skills and as a pharmacist, because I can't work on code, but I can help people that are stacking Bitcoins. I can help them, because I say better money, better bodies, so I can help the people that are already taking that low time preference mindset towards their money and apply it to their fitness, and take like a dollar cost averaging approach to their fitness. It's just starting by doing, a little bit over time and improving those habits, those skills, and, slowly changing those behaviors.
Mate, outstanding. Because the next question I was going to ask you was about how do you influence behavior in those people to actually give them a hand. But it sounds like they have a willingness to change first. It sounds like they come to you and say, "Hey, I want to change. How do I do it?" So for me, maybe there's not a lot of influence on your behalf. It's maybe keeping them going and really giving them the tools and the tips and the tricks. Is that right, mate? Or do you
So
see these people?
there's a mix of like motivational interviewing, like when you talk to somebody and you get them to think about what's really important to them. When they start thinking about, like, 'cause sometimes people say that it's not worth it to them, they don't have time, whatever the excuses they have, they believe. But whenever you say, well, what is important to you? My family's important. I want to be there for my kids. I want to be able to do this. And then so you say, okay, well, how do you going to increase your chances of doing that? Because you need to be doing these like health and fitness type things. So if you get them to bring it in front of mind, what's important to them, then you can lead them into, okay, well, here's the best way to do that. And, so it's a mix. It's like sometimes, people, because people are on a spectrum, like they have to want it, right? But you can't, I'm not, like, I don't just come across people and I say something to them that completely change their life around. But if they're looking for the information, they're starting to think, hey, I'm on an unsustainable path. What I'm doing is not good. I need to do something different. Then they start looking for the best ways, just like I did. I started looking for answers, and then you're gonna find people that hopefully are leading you down the right path.
I love that, mate. So for you, influence really is around locking people in, linking people to, I guess, a future state, Dr. J, and saying this is possible, but is it important enough for you to make some changes? Is that sort of a,
Yeah.
a good way to sum it up?
Oh yeah, that's great. Great way to sum it up.
Perfect, mate. Love that. So in saying that, Dr. Jane, I'm really, really keen to hear your take on this. So I'm early 50s now. I've done triathlon for 20 years, so I've managed to keep my body moving, which is really important for me. Run every day, except for the moment I'm out with a busted quad, but anyway, slipping in the snow, but that's another story. Um, and I've got friends at my age, yeah, who they'll go to the doctor, and the first question a doctor asks them is, "Give me the list of meds you're on because you're in your 50s now." And and I've heard that more and more, and it like blows my mind because the only meds that I would ever take are multivitamins and sort of more proactive rather than reactive meds. But and it's because I haven't, I guess, needed to yet, and maybe it's a lifestyle thing, or maybe it's just biological or genetic. Maybe I'm just lucky. Who knows? But yeah, this conversation's been really, really interesting because you can turn around biological markers, whether it's cholesterol or high blood sugar or whatever it is, with the right strategy. And maybe for our listeners, Dr. J, maybe the top three things for you. What if you there's people out there listening to this, and if you had their ear and you only had sort of a minute or two, give us if you wanted to turn your life around from I guess, a medical perspective or I don't know, general health perspective, what would you recommend, Dr. J, please, mate?
So 7 to 9 hours of quality sleep. So that's no alcohol, within, at least within, 4 hours of sleeping. No caffeine, really, because caffeine has a half-life of 6 hours. So you want to avoid that 6 to 8 hours before bed, because that can disrupt you from sleeping. The same thing with alcohol. It prevents you from getting to the deeper, more restful, impactful stages of sleep. And sleep is one of the most performance enhancing things that you can do. So, and a lot of people are underslept. So that's the first place. It's like watch your sleep and get some consistency around that, because people, like, oh, I'll sleep when I die, that kind of hustle culture thing, and they're really impacting their performance in a negative way whenever they're running off 4 or 5 hours of sleep, especially chronically, because a lot of people they get used to doing that, whatever it is that's keeping them up. And so that's the first place to start, is to sleep. The second thing was just to walk more, right? Sitting is the new smoking. So the less that you can be like, the American Heart Association, they recommend getting up and walking around for 2 to 3 minutes at least every 30 minutes. And that's something strange for most people. So if you have a standing desk, utilize a standing desk. If not, request one, all that kind of stuff, because the more that you can be up and walking around and moving your body, like that's more blood flow, and that's going to lower your chance of having a stroke. And heart disease is one of the biggest killers, globally. So that's the thing that you would start with, is just moving more. As far as like how much that you should walk, um, you know 10,000 steps a day is a good round number. um, that's that's something that I really like to have people focus on. And then the last thing is the consistent exercise, so making sure that you're doing at least 2 days per week of strength training. I usually aim for 3 days, like to have 2 days where you focus on strength. You can either do full body or you can do an upper lower split. Then have one day where you do stuff like with you directly targeting your mobility, your agility, where you work, do like a sprint or faster runs, because all that's going to keep you young. And it's one of the best things that you can do, like health wise, because a lot of people, they stop doing that. Like there's like a stat out there that says 95% of people never sprint again after 30. And, when you look at how people's, like people that are in their 30s and their 40s act like they're over the hill, because, they're like, oh, I'm getting old. You hear them, oh, but the biggest thing is they stop moving. And you got to push through that. And you can't just get set into your ways, going to work. And then, whatever it is that you do with your pastime, a lot of times people, they get off of work and then they're mentally drained from that, whether it's a physical job or it's like a mentally, demanding job. They get off and then like all they want to do is sit down and watch TV, or it's just be on the computer. And like you got to fight against that. So if you focus on those three things, making sure you're getting enough sleep, try to get 10,000 steps a day and just walk throughout the day, and then strength train, like include that into your day, then that's where I would focus on.
Thanks. Beautifully answered. Beautifully. That is so cool. And this is what spins me out, Dr. J. Not many people wear really simple devices that track your sleep, that track your steps, that track your heart rate. Resting heart rate is such a big deal. We know now in cardiac research is that some of the resting heart rate data shows that over 90 beats a minute resting heart rate is quite risky. 60 to 80 is normal, 40 to 60 is athletic, and then under 40, sort of like Usain Bolt, he got down to resting heart rate of 33. But you know what? No one tracks their resting heart rate, Dr. J.
Yeah, it's that was one of those things where before I used to think, oh, I don't need a step tracker. I don't need because I know I walk, because like I know I'm doing certain things, but I walk a way more now that I can see how many steps I'm getting. And it, like even if this thing, it'll tell you like, okay, you've been sitting down for an hour, you got to get up and move. And that really helps. It's just like a behavioral thing, kind of nudge you in the right direction. And that's good if you're just locked in to like either reading a book, reading stuff online, or whatever you're working on online. Like a lot of the stuff that I do, whenever I'm doing my editing or I'm talking to people in the DMs, for my business, I'm checking on my clients, is I do that when I'm walking. I just kind of walk around the neighborhood, or I walk on a treadmill and do that while I'm standing up. And that's been a game changer.
And for everyone out there, I encourage you to have a look at Dr. J's Insta page and just see what Dr. J's done with his body. Dr. J is in amazing shape, and Dr. J is actually a walking, talking sort of example, Dr. J is a product of the product, which and it's really cool to see that, because you literally walk your talk, Dr. J. So, you're an example of what's possible. When people look at you, they go, right. And there might even be a level of inspiration in that too, Dr. J. People look at you and go, well, if you can do it, maybe we can as well.
Yeah, and it's so my page is called Proof of Work Fitness, and proof of work is a Bitcoin consensus mechanism that basically means that a computer is doing like a certain set of work, they're doing something, and they get a piece of data, and that data is quick and easy for other computers on the network to verify. It's just the same way as your fitness is somebody can look at you and they can tell you that you're in good shape just by like it's on site. So to me, it made sense to have proof of work fitness. So, and a biggest thing, and I talk about dollar cost averaging into your fitness, I'm not working out 6 days a week. I'm not working out having these crazy long workouts. Like there's some workouts, yes, I push myself, but I've built up to that. It's more about continually doing a little bit over time. Like a lot of people, they get out of high school and they stop training altogether. I just never stopped. I just always kept doing a little bit. Even the times whenever I would struggle with consistency, I'd get to a certain point and it's like, oh, I can't see my abs anymore. Now I got to start running and start watching my diet again. Then I'd get to a certain point, then I kind of fall off. But after I turned like 30 or something, I stopped falling off like that. And I always maintained a low level of activity. And now what I focus on my clients is getting those steps, make sure they're doing, at least 2 to 3 workouts per week, and they're getting their sleep in and tracking their nutrition, their calories and stuff like that. That's one of the things I didn't mention.
And a shout out to our sponsor, W. Daniel Cox III, who advises boards and executive teams on data governance, data strategy, and AI governance. His work focuses on helping organisations align growth strategy with clean, traceable, and defensible data. Click the link below to reach out to Daniel for any help with your data governance. Track calories. That's really important, because you sort of, what you can measure, you can monitor, and what you can monitor, you can manage, right? And improve. So. I love that. Thanks.
And even if you don't want to track, if you just change a few things around where you prioritize protein first whenever you eat, you focus on having more whole foods, that's really going to help you, because you're going to get full on that, quicker than if you're eating a lot of processed foods that are loaded with calories that are like chemically engineered to make you want to eat more. And so if you just, give yourself over to then, food industrial complex and just, always being some kind of line, always eating some kind of processed foods, then you're going to get the same results as everybody else gets, And so it's like over like 70 something % of people are obese now, and they're eating too many calories and they're not moving enough. So the easy fix for that is just to focus on whole foods and just to move your body more.
Love it. Beautiful, mate. And just for our listeners and viewers, I'll put this out there and make a commitment. So I've got a 5 million step goal this year, Dr. J. So,
oh, wow.
I'm trapped. I know, right? So that's 13,700 a day. So I've been out and I'm up to 7,502 for today. It's just another little way to make sure that I keep moving. It's one of my fitness goals for this year. So I really get that. Keep your body moving. Have a stand up desk. So.
Yeah, that's great. I applaud you for having a stand-up desk. And, if you're somebody that works in an office, you can be a positive influence on everybody else that's in there, because they see you standing up. And I know it's happened to me at the hospital. People see me using the standing desk, and now there's a few other people that started using the standing desk. It's like we're sitting there for 8 to 12 hours, and we're healthcare professionals. Like, what are we doing? We see what happens when people spend their whole lives sitting down, not exercising enough, eating too much food. So why not, change the things that you can change, focus on what you can control. And, like part of the mindset stuff is, I got into stoicism, and that's more about that teaches you to like, don't worry about the things that are outside your control, but if there's something that you can do something about, do that thing. And so if you take ownership over the things that you can change in your life, with like what you're putting in your body, how much you're moving, how much you're sleeping, and you're, how to form good relationships with people, because you don't necessarily have to say these hurtful things, because your social relationships with people, they impact how you feel. So like it's all intertwined. And I just help people to focus on the fitness first, and then that bleeds over into everything else. Because if they can prove to themselves that they can show up fitness wise, then hey, you know what? Maybe they can go out and go meet some new people, or join a friend group, or some type of social outing. And that's it all goes together. There's 8 areas of wellness that I focus on, And social wellness is one of them. Emotional wellness, occupational, environmental. I mean, there's it's kind of a lot to it, but you know, you said something about, it's a lifestyle thing about the medications, and it definitely is. I mean, of course, there's some people that have a family history, but when you hear people say, "Oh, I have a family history for diabetes," it's like, well, anybody that does, they're not moving enough and they're eating too much food, a lot of high sugar food, you're going to get diabetes. That's just what happens to the body. But if you look, 100 years ago, that's what wasn't happening to everybody. It's our lifestyles. Our lifestyles have changed. Before, people would walk 15,000 steps a day. Now we barely get 3,000. So that directly impacts, because if you're giving your body too many calories, it's got to store it somewhere, and that's it's all tied together. But it's easy fixes, but it's more about consistency, because you have to do it and you can't fake it. It doesn't matter how much money you have. There's people that are billionaires and they've got health problems because they're not moving their body or they're eating too much. And so, like, it's an easy fix, but it's something that everybody has to do for themselves.
And I love what you said there at the start of that, Dr. J, where you said people see you doing the right things, like a stand-up desk, and all of a sudden they change their behavior because of that. I think from an influence perspective, sometimes that's all it takes, like for you to be the example. Would that be a fair call?
Oh yeah, absolutely. And that's that social pressure is a good thing, because it helps when you make a commitment saying, "Hey, I'm going to hit this 13,000 step goal." Now, if you're having a day where you don't really feel like it, you're like, "Yeah, but I said the thing, I got to get up and do the thing." Because yeah, I don't always want to get out and go walk or something like that, but it's like, I got my clients doing this. I've been telling people to do this, so it's like, let me get up and go spend a few minutes, walking and hitting these step goals, because I know it's in my best interest. And that social pressure, like I said, is, it helps to keep you on the right track.
I've never ever heard those two words put together like that. Social pressure driving change. I like that. Thank you so much. That's something I'm going to really lean into, because some people say tell everyone your goals so that they can hold you accountable. Other people say don't tell anyone and wait till you've achieved it and then tell them. But I like that. I like those two words, social pressure. I'm into telling everyone, so that I just find that most people forget anyway, because they're not interested in me, they're interested in themselves. But when you make it, I think when you verbalize it, when you put it out into the universe, it becomes, I guess, a commitment, and it becomes more than just your own little personal goal. It becomes something that that you need to hold yourself accountable to, because at the end of the day, you got to look yourself in the mirror. If you say you're going to do something, well, you follow through, and that's
Right.
integrity and leadership, I guess.
Exactly. When you talk about leadership, leading by example, that's what I've always, been an advocate of, is I'm not going to ask my clients to do, or I'm not going to advocate for other people to do something that I'm not willing to do myself, because I give people good advice. So it's like, let me follow my own advice. Sometimes you just, and that's the same thing. It's like, a lot of people could do the same thing. A lot of people know the right things to do. They're just not doing them. And so if you just take the approach, it's like, how would, you know, you, what I tell people to do, like, to get through something, is like, how would this person handle this? This person that you look up to, how would they handle it? And then you just pretend like you're them, and do what they would do in that situation. And if you just get through the next few hours, how you picture, however that other person would do, that'll help you get through those tough times. Because sometimes, we're sad, or something has got us down. A lot of mental health problems, stuff like that. But if you say, okay, well, I would do if I was this person, how would they handle it? And let me do that, and that'll get me through the next few hours. And before you know it, you got through the day. And then you keep stacking days, and then before you know it, like, you've changed your whole lifestyle.
I love that, Dr. J. That's like, it's like sort of a role model process, isn't it? Again, it comes back to that inspiration piece. Who do you look up to? Who's your role model? Who's that person that you want to emulate, for example? And then when you're in a tough time and you've got a big decision to make, what would Dr. J do, or what would this other person do, or what would
Right.
Richard Branson do in this situation?
Exactly. Yeah. Because I have a coach. I think, well, what would my coach do in this situation? He definitely wouldn't be sitting here feeling sorry for himself. He'd get back to work. He'd get back on the horse, and he would, make sure it got done. And so that's, whenever I have days of like self-doubt and I'm questioning myself, I understand that's part of the process, but I'm not going to stay there. I'm going to focus on the positives. I'm going to do what's within my power to, improve my situation.
Wow. That's really powerful. Thank you. And that's probably a good message for all of our listeners and viewers. Who's the role model in your life that during a tough time you can actually say, and Dr. J just said Dr. J's got a coach. Who's your coach that's probably not with you all the time, though at the same time can be your coach with you all the time when you say, what would that person do? I think that's really powerful. Hey,
Thank you.
Dr. J, quick one. Yeah. Quick one for you. Who influenced you? Like I guess, and I'm going to say it was, and I, huge condolences, mate, for losing your mum in a situation like that. So thanks for being so open and honest about that. I guess that was a huge influence. Anyone else or maybe that's the answer to the question. But the question I usually ask is, who influenced you the most in your life to, I guess, achieve what you've achieved so far?
Yeah, so, my mom definitely did play a big role. She taught me, that, she loved me so much and that I could do anything and just never, you know, just to really believe in myself. So she definitely instilled that into me and that I was loved. We were a hugging family. And so my mama, my papa, like everybody, we always hugged each other and let each other know, my cousins, everybody, we always let each other know we loved you. Like whenever you're leaving, everybody's giving, each other a hug. And she ended up getting with my stepdad, and he had a big impact on like my mindset and stuff like that because I grew up, I had a rough childhood and moving around a lot of places and getting involved with people that were not on good paths, that were like getting into gangs and stuff like that. And whenever we moved to go live with my stepdad Frank, he he talked to me a lot. Like instead of me taking my anger out, like, violently with hitting stuff, he would just talk to me and he would drive me around and he would have me talk about my problems. And like, he would ask me questions to make me think about, like, make myself think through whatever I was feeling and use my words. And through that, I decided that like, I knew the path I was on wasn't sustainable and I need to focus on my grades. I need to focus on doing things that are within my power to improve my situation. Because if I don't, I'm going to end up dead or in jail, or I'm going to end up, drinking myself to death and stuff like that. So, if I want to be different than what I was seeing with my mom, the stuff that I was unhappy with, that I have to live my life differently. And I have to, you know, um, carry myself different, in a different way. And so that, like seventh grade, I made that switch where it's like, all right, let me focus on my school. Let me try to make my mom proud. Like no matter what she's doing, I can do what's within my power. And, so that's just kind of like led me down like a different path as far as just like where I was going in my trajectory. So I stopped because I used to idolize this guy that was in a gang, and he was, the leader of his friends, had a couple girlfriends, and like, he was like the cool guy to me. And he told me like, you don't need to like idolize me, but I would told him you're my idol. And um, but he's just like some teenager that deals drugs and drives around and has a bunch of friends. But to me, he was cool. Was going to parties and stuff. Um, but it took me talking to my stepdad Frank, and he kind of slowly like asking me questions got me to like I said about the motivational interviewing. He kind of was using that on me, back in the day, and then I just started changing the stuff that I started doing, and that really changed the direction that I started going on in my life.
Wow. Holy mate, you have got some of the best answers to these questions.
Yeah,
Mate.
it's like I said, I don't want to get like graphic and stuff like that, but I had like, I was definitely going on. I mean, of course, there's always people have a worse story and stuff like that, but you know, it was like traumatic to me, a lot of the stuff that I went through. And when the people that knew me from whenever I was younger, they say, "Oh, like you just overcame so much," and it's just like it's good that you got your head on your shoulders and like you got to this place. But in the moment, it was just like survival. It was like, how can I get through this, and how can I prevent something like this from happening again? Because like I don't want to go through that again. And so, you know, but I think Frank had a big impact on that. It's just like getting me to think through problems and not act emotionally, and just getting to kind of take a step back and say, how can I, improve my situation for the future? Like even if this bad thing happened, how can I prevent it from happening again? And then just, if you just, take your life like that, that's how you make the changes, because you're the only one that's going to change your life, because nobody else cares enough. Like people will watch you do crazy stuff, and they might warn you, but it's up to you to take that advice and to do something different with it.
But what I love is, you know, Frank wasn't heavy-handed. Frank wasn't your stepdad wasn't, overbearing. It was just like this whole coach. It was like he was coaching you at that age, just to
Yeah.
help you find a way, and that's that motivational interviewing starting in the seventh grade or whatever that was. That's off tap. That is really, really cool. And obviously for you to end up where you are now, if other people are noticing that's a massive deal. So congratulations. And you've turned obviously someone who was an idol at such a young age, another teenager, gang member. Now you've found better idols, and I'm sure that your current idols have achieved a lot more than probably. Is that person that you
Yeah.
idolized as a teenager, are they still alive, just out of interest?
I haven't seen them on Facebook or anything. Like I haven't really looked for them, but I mean, I'm sure they are, but they're not in the positions that I want to be in, and so like not my coaches now, they have the things that I want. They're doing the things that I want. So I learned to like follow in their path, because, that's where I want to be. I don't, you don't take advice from people that you wouldn't trade places with. I mean, of course you can take a good idea from anywhere. I'm the type of person, I'll take a good idea from anywhere, but you know, you have haters and you have people that are trying to give you advice, trying to tell you to do something. And, if you wouldn't trade places with them, why are you going to take that advice on something that can really impact and change your life? So, that's something that I've been following for a long time.
Mate, I love that. I'm just writing as we speak. I've taken a couple of pages of notes. You I've never heard that saying. Don't take advice from people you wouldn't trade places with. Oh, that's phenomenal. Brene Brown wrote that book about leadership, and in that book, the preface of the book was the quote in the arena, the man or the woman in the arena, and what that quote is about, Dr. J, is that some people, and it's this great quote, I think Roosevelt maybe, or probably not Franklin, but the quote goes something like this, and it's quite a long one. It's about the man or the woman in the arena who is scarred by blood and by doing, and then there's all these observers around the stadium who want to give them advice, but they're not in the arena, they're not in
Right.
there doing it, sweat and tears, and who are you going to take advice from? Are you going to take advice from people in the arena, or are you going to take advice from people in the stands? And I just love that man or woman in the arena quote, and that's what you're talking about. Would you trade places with someone? Don't take feedback or advice from someone that hasn't achieved what you want to achieve.
Yeah, because
Mm.
you'll have people telling you, like they'll say, "Oh, well, you're not big." They don't want you to exercise. They think if you're trying to eat healthy, like it makes them look bad because they're not caring about their physique or their health or anything like that. So, people will try to tell you, something to make them feel good, or they'll tell you not to start a business because, you know, what if you make it? What if you prove them wrong that, you shouldn't have just worked, for somebody else for your whole life, and you shouldn't have took a risk on yourself. It's like, but you know, take that bet, make that risk. I mean, of course, get yourself set up, do a little bit of this, a little bit of that, but you have to bet on yourself. I mean, if you don't, then my thing is I don't want to live and be regretting if I didn't take the chance, if I didn't bet on myself. So because you can't change it. We get one go through, we get one playthrough, and you may not respawn. And so you got to make the most of it.
Dr. Jae Koonce, off tap, good, great chat, great podcast episode. Thanks so much, mate. I
Thanks,
really
Anton. I
appreciate it.
appreciate you.
Yeah, mate,
But this was
it
fun.
was really worth it. I think we should do part two and talk about Bitcoin at some stage in the future. Is that okay, Dr. J? Because I really want to unpack that. That was part of the comp, but we didn't quite get there because I think, you just
Yeah,
had too
yeah.
much other.
Bitcoin is it's something that I feel very strongly about, because fitness and finance are my two favorite subjects. So, if we can just get people, focus on their fitness, focus on their finance, because, you know, the things that matter in the world are, your health, right? Because if you're not healthy, it doesn't matter how much money you got. That's your problem. But then aside of that, you got to have money to fund your lifestyle and to do things, or else you're going to be very limited. And So if you're doing what you can, what's within your power to optimize for, your money situation, your finance situation, and your fitness situation, so that you can do the things in the world that you want to do, so that's the key things to focus on. And it helps everything else, because if your fitness in order, your finances are in order, then that's going to help you. And, romantically, it's going to help you to go out and do stuff socially. And so those are the two key drivers.
Mate, I love it. And I put family above it too. I say family, fitness, and finance, Dr. J. So that's
Okay. Yeah. Because that's what's important to you, right? Because it's like,
yeah,
okay,
right.
if you're not healthy, that's a big problem. But then if your people that are around you, if there's something wrong with them, that's going to bring you down too. So yeah, I mean, I like to throw family in there as well. That's great.
Oh, mate, thanks for sharing. Dr. J, as we wrap up, the last question that I always ask our amazing podcast guest is this one. And it is, if we emailed you, would you mind doing us a huge favor and connecting us, introducing us to other humans that you think would be a great guest for our podcast, please, mate? Could you make some intros, please, of people that you think have changed the world that could help our viewers and our listeners, if that's okay?
Yeah, that sounds cool. I'll do that.
You're a legend, Jay. Mate, thanks so much. That's just been so great. We'll let you know when the podcast episode comes out.
Yes, sir. Have a good one.
Find Your Influence podcast with Anton Guinea. Another great chat. Please be one of the 10% of people who follow and subscribe and like our videos, so that you can get more of them and you can hear more of our amazing conversations, the conversations that I get to have and that I get to share.